Hello, everyone. It's Heather Holmes here with KTVU Channel 2 News in the San Francisco Bay Area. And joining me this afternoon is Stacey Allegro of Novato. Stacey, thank you so much for talking with us. You have endured quite the ordeal. Talk with me about when you first got symptoms and then what's transpired since then.
Yeah, so as far back as I know, my husband came back from a trip to Morocco on March 9th. He was only gone for about 8 days. And after that, he started developing sort of like a little cough. But I had taken all the precautions because while he was gone, I was sheltering in place. I already saw what was coming. The rest of us saw what was coming. Excuse me. So I sheltered in place, and when he got back, I made him take off all his clothes at the door. I made him, strip down, put all his clothes in the washing machine, did all that, and then made him take a shower, and even took a bigger precaution where I was sleeping in my office and he was sleeping in the master bedroom. But I guess that wasn't good enough for the virus, because on the night of the 18th, or the morning of the 18th, I came down with this really horrific cough. It was just the worst cough ever. And he said, he had a little cough, and he had all of a sudden he said he lost his sense of taste and smell and everything like that. And by the night of the 18th, I was running a pretty good fever. I generally run low. I'm healthy. I'm a Pilates instructor. I run about 96.7 or 97.4. I was hitting 100. And that was happening every 4 hours if I didn't take Tylenol. So I started getting fever really bad. Chills, a rash started forming on my back. And all this time I'm in touch with my doctor, and she was amazing. She basically said, look, we're treating everybody like they are COVID positive right now, but believe me, you don't want to be in the hospital. So if there's a way that we can keep you from coming into the hospital, we're going to try to do that. So she treated me symptomatically, probably the same way they would have treated me symptomatic. So the days passed. So now we're looking at 9 days with fever every 4 hours. And now it's getting higher and higher. So she was working the tent that night at Kaiser, and she said, look, I'm working tonight. Please come down here. I want to get some eyes on you. So I went down there. They did a chest x-ray. They determined that I had community spread pneumonia. I also had fever. I also had that.
Did you get a COVID-19 test?
I did not. And I am going to circle back to that, right?
Okay.
So the next day, my fever spiked to 103.7. So I was sent home with what they treat pneumonia with, Levaquin. The next day, my fever spiked to 103.7. I became delirious. I mean, completely delirious. They told my husband, who they suspected was also infected, but to drop me off at the emergency room. So they dropped me off at the emergency room at Kaiser. I was in the waiting room, and I think I passed out because I don't remember a thing after sitting in the waiting room to where I got with the IVs in my arms and doctors scrambling and nurses coming in in hazmat suits. And so after that, they admitted me to the hospital, put me in ICU in isolation in one of those rooms. And I spent the next 7 days just terrified in the hospital, not knowing whether or not I was going to live or die. But so circling back to the test, so everybody was asking me, are you getting tested? Are you getting tested? No, I'm not getting tested. Why aren't they testing you? Why aren't they testing you?
Mm-hmm.
I do not blame Kaiser for this. This was not Kaiser's fault. This was the fault of the CDC and the nation, because I didn't meet the criteria, the 15 or 20 criteria that the CDC at that time was saying you have to meet every single one of these criteria or you can't get tested. What it basically was a stall maneuver, because they didn't have the tests that they needed. But in the emergency room, I did get tested. I did come up COVID positive, and they knew then.
Mm-hmm.
So being admitted into the hospital, and then they took me up to the room, they hooked me up, and I was feeling awful. I mean, my liver numbers were terrible. My kidney, everything was going wrong that could go wrong. And, I have a very close family. My family we're from Ohio originally. My mom lives here, my dad lives here, but all the rest of my family lives in Ohio. And, you know, we were supposed to be going to my nephew's bar mitzvah this weekend and his 13th birthday tomorrow. So we just do that. If somebody's in crisis, we get there. And I think laying there with these tubes in my arms and people coming into the room with these hazmat things on their face and so many, I just didn't recognize, you know, they look like something out of a Bad Orson Welles sci-fi movie, right? And so what I decided to do at that point was start asking their names and start asking who they were and do they have children and why they got into nursing. And the reason I did that was because I really had to humanize the experience. And the more I got to know them and the more that we started talking and everything, the nurses and the doctors were amazing. Because once we got to know each other as people, I wasn't just a statistic in the COVID-19 pool. I was actually a real human being that was sitting there having these issues. And I just cannot believe to this day that the doctors and the nurses put their lives at risk to save mine. And sometimes I feel guilty about that. You know, it's like, why would they do that? But without them and without my incredible, you know, GP, Orna Hananel, I wouldn't be sitting here. I mean, they did things for me that were extraordinary. My doctor had supplies sent up to me and the nurses brought me special little treats and they did as much as they could do, which is one of the reasons I left that. I think I sent it to you, the wall art that I did, because it was the only thing I could do was to leave this message because I couldn't give them anything. They couldn't take it out of my room. So, and I had to tell them, I just had to tell them how spectacular they all were because I wouldn't be sitting here, not just because of the medical treatment, but the emotional support that I got from these people who became my family because I couldn't see my own.
Yeah, so talk a little bit about what you did, and let me get back here real quick. You know, what you did as a way to thank those who helped you get through this. Talk a little bit about what you created.
Well, so I was scrambling. I mean, I was really, you know, I didn't have anything in the room. I basically had the clothes I came on my back. And one of the social workers had been calling me and they had all these teams. Kaiser saved my life twice now. I'm also a cancer survivor, but Kaiser saved me twice. I said, look, Kaiser, I don't want you, third time is not a charm. I don't want to do this again. But I can tell you that I got calls from social workers and spiritual people and chaplains and things like that. I didn't really like this call from the chaplain. I thought, wait, I'm not supposed to be getting this call yet.
Yeah, that would make me a little nervous too.
Yeah, but what I did was they had sent up some paper and pens so that I could organize what I might need to grab from my house before I had to go up into isolation. And so she had sent this big stack of, you know, copy paper. And I thought, okay, I'm just gonna thank everybody. I had taken down everybody's names for the whole 7 days that I was there. And I just started writing this note and it just sort of spurted out. And then I thought, well, this looks sort of bad. I have to decorate it. So I blew up the surgical gloves that were in my room and I folded a little origami bird to sort of show it. And I just listed everybody's names and, you know, thanked them. And I have gratitude for the people that put themselves on the line every day. I can't even explain the gratitude. And I still think about these people. Like, I wonder, are they okay? Because I do know them and I know who they are. And I want to follow up and find out after this is all over if they made it.
What was their reaction when they saw what, you know, this loving letter essentially that you wrote to them?
The nurse that had been attending me that day came in and started reading it and started pretty much sobbing. She said that she had not gotten anything like that since she'd been working, and I'm sure it's hard for people to say, you know, but I just couldn't believe that she was overwhelmed. And then all of a sudden another nurse came in and then they started taking pictures of it. And then I got a call from Kaiser Regional, the regional headquarters. I don't even know where they are. And they said, would it be okay to share this with the other nurses and the medical staff? Because they need to see things like this. I said, you don't even have to ask. Please share it with as many people as you can.
Yeah, yeah. So I want to go back to how you're doing now. How are you feeling?
So, it's strange times right now, right? So I, it's a little bit odd because when you go into the hospital or you go to the doctor and they give you medicine, you take it and you get better most of the time, right? There's a beginning, a middle, and an end. And this just doesn't have an end yet. Because I was told that I had to be in isolation. We don't know how long until I'm asymptomatic. And since I still have pneumonia and still have some of the night sweats, I can't even count myself as asymptomatic. So I could be by myself for the next month. Now, thanks to digital stuff like this, and I can see my mom now. I can talk to my family, but the days are long, but the nights are really hard because I still wake up pretty traumatized by like thinking that I'm still in the hospital. So as soon as it starts getting dark, my little monsters come out.
Yeah. What about your fever? Do you still have a fever now?
No, this will be the 5th day, hopefully, that I have gone Tylenol free and fever free. So that is one of the things that they are absolutely following. That's most important for them to determine, where I'm at in this process. So yeah, that's, but I'm still really shaky. My voice is shaky. My body's shaky. I have a cough that's pretty annoying. I have to use this little blow thing, one time an hour, and practice the breathing and stuff like that. But I miss my family.
What about your husband? Did he ever get tested for COVID-19?
So they didn't test my husband, but they assumed that he was positive because he had not nearly as bad as I do. He lost his sense of taste and smell. He had the cough. He still has it. I talked to him this morning. Thank God that he didn't get as bad of a case because I have a 105-pound dog, Benny, that's the love of my life, that has to be walked pretty like twice a day, and he's able to do that. I'm praying that next week I'm well enough to bring my dog up here because I want my dog. That's I want my dog.
Your message to those who right now might be enduring the same thing that you did in the hospital, and also your message for those who are going to work every day to treat COVID-19 patients.
My message for those in a similar position would be that to try to be as strong, to try to call upon whatever strengths, whatever mindfulness techniques, whatever thing is in your body, whether it's somebody you love that keeps you going, or somebody that you still want to be around for, if you have kids and you need to fight that fight, whatever it takes, because there is an end to this. I survived it. There's lots of people that are surviving this virus. It's not pretty, it's not fun, but you can get through it. And I think that there's so many, like I said, all these death numbers being put up on the screen, and it's affecting a nation in a really harsh way. So I think people really need to know that there are people that get through this, and there are a lot of people that get through this. And then secondly, if you are in a position where you do end up in the hospital, know that these people that are coming to be with you, that are coming to care for you, that are coming, they too are afraid, but they're not so afraid that they're not there taking care of you. So please show them gratitude. Please thank them on a daily basis for all the work that they're doing. And lastly, I think the more important thing is the people that are out there, because I get from friends that there's still people out there without masks, without gloves. My message to people out there is you need to take this amazingly seriously, and whatever you think you're doing is not enough. You have to do that much more, and stop ordering takeout food. I was surprised at some of my friends that were getting bored and they were ordering takeout food. And I asked them, and I understand why, but buy a gift certificate to that restaurant. That's a better way to support them. Because they said, well, there's nothing wrong. They don't even touch you when they come. They put it on your doorstep. And I said, would you invite the people in the kitchen into your living room right now? And they said, no. And then I said, well, every time you order take-in food, you're inviting those people into your house and everyone they've come in contact with. So buy everything you need, stay at home, shelter in place, don't go to the store every couple of days, make one run, make it last for a month, and stay home. It's the only way we're going to deal with this.
Well, Stacey, I'm so glad to meet you and to know that you are on the road to recovery. I know it has not been easy for you. And thank you again for taking the time to share your story, and also that loving message for the healthcare workers. Really so touching.
They're my family now.
Thank you so much. Appreciate it.